There we go. All right, great. So thanks for taking some time today to talk with me a little bit about your center and what you guys are working on. So why don't you tell me a little bit about your center and your role there?
Okay, well, first of all, let me give you a fuller introduction to myself.
Great.
My name's David Armstrong. I work for the New York Center for Health Workforce Studies, but I'm also presently serving as the director of the Health Workforce Technical Assistance Center. And we're a joint collaboration between the New York Center for Health Workforce Studies and also the Shepp Center at the University of North Carolina, Chapel Hill. And essentially, our mission is to support the efforts of HRSA's National Center for Health Workforce Analysis by providing technical assistance to states and organizations who are engaged in health workforce policy.
Great. So what initiatives are you working on currently?
Presently we have 3 initiatives. And really, 2 of them are more outwards facing, so I think I'll discuss those more so, albeit the third is also very exciting. Our main initiative, and really what we do, is provide technical assistance to states and organizations engaged in health workforce policy and planning and other activities. And what I mean by this is we offer free consultations to individuals, different organizations, who want to go about collecting health workforce data, analyzing it, and reporting it. And so we talk to a lot of people who are just getting started, and they want to know, well, what types of questions can we ask? What types of questions should we ask, I should say. And we can provide them with examples of questions. And we can also tell them best practices for going about collecting the data, like what's worked in the past for other states and organizations.
Great. That sounds like a great resource to those entities. So how are you funded?
We're actually funded by HRSA's National Center for Health Workforce Studies, by HRSA's National Center for Health Workforce Analysis. I have to make sure I get that one right, obviously.
Great.
And it's actually a 4-year cooperative agreement, so we're not going away anytime soon, or at least we hope not. But that's where we get our funding from. And so this is really a free service HRSA is providing because they are interested in health workforce. And by giving people more opportunities to get started, it makes it more sense for everyone.
Great. So the states or people who are coming to you, there is no cost associated for your help?
None whatsoever.
Great.
Now, clearly, we would have limitations if we got flooded, but that hasn't happened yet. And so I'm actually very thankful for this opportunity to help us get the word out.
Great. That's awesome. So what do you hope to accomplish with your efforts?
Well, we hope more states engage in health workforce planning. That is evidence-based health workforce planning by collecting data, analyzing it, and using that information to implement sound plans rather than like just going off anecdotal information. Because you really do need evidence-based approaches. And to start that, you have to have the basic information, and that starts with basic collection of information about health workforce professions, physicians, RNs, behavioral health, you name it. If you want to make decisions based around these professions, you need to know what they're doing at the moment.
Great. So how can states reach you if they'd like more information?
Well, we have a website. I'm glad you asked this. It's at healthworkforceta.org. So any state, any individual can go to our website and look me up and other individuals of our organization. Feel free to contact us. Email me directly if you like.
Great. Thank you so much for taking time to talk with us today, David.
You're more than welcome. And thank you for the opportunity.
Great.